chances are it's the stresses of daily living that are causing the real problem. And they can go to the doctor any number of times, take any number of meds and prescriptions, do tests of all sorts, and they don't solve the problem. You have to recognize early on that the problem is complex. Good morning, I'm Dave Haddick. I am the CEO of PSYCHeANALYTICS. We've been a member of Startup Health now for 3 years, and we really treasure that association, and we're happy to have this opportunity to talk to you about my company. PSYCHeANALYTICS was founded some years ago by a group of psychologists who wanted to help primary care doctors understand the totality of their patients so that they could deal with the behavioral health issues and other psychosocial issues that are more prevalent these days than medical issues. As time has gone on, we've developed a technology platform that sends text messages to patients before they come into the office. Our specific interest is in primary care behavioral health. It's a specific model of treatment that involves very brief interventions with a behavioral health consultant. But since then, the world has changed a little bit, and primary care doctors have been burdened with so many more things than they ever thought they'd have to deal with. The EHR was enough for most people, but now they have to deal with behavioral health, they have to deal with social determinants of health, and other issues that make the patients unwell, besides medical problems. Our job is to help the patients navigate this more complex world of team care. It's not just one doctor, one office, and one receptionist anymore. There's a whole team of people in primary care that help patients. These include nutritionists, behavioral health consultants, social workers, pharmacists, psychologists. And the problem is that the patient doesn't recognize that coming in the door, and we help them understand that there's a team of people waiting to help them, but they need guidance from the patient. So we send text messages to the patient and exchange information with the patient to help them understand what they're getting into and where this will help them. I think it's even more important today. Everyone's talking about the digital front door. Now, if you have a digital front door, a totally remote telehealth environment for primary care, you need documentation, you need patient data much more than normal, because you can't just see and react to something the patient reveals to you in the visit, because they may not reveal it since they're on a telehealth call. So we think it's more important than ever for patients to have access to means to tell this team what their needs are. And we guide them through that with a process of sending them questionnaires because they don't know what's available. So we're trying to bridge this gap of availability of ways to help them be healthy compared to the lack of knowledge of health literacy in general. Now, these days it's even more important because the whole issue of cultural sensitivity and cultural awareness has become a dominant force. Our particular market is Medicaid patients, federally qualified healthcare centers, rural healthcare centers, and this fragmented and distributed delivery system where there isn't any economy of scale on the provider side. So we hope that in a few years we will have thousands of clinics using this simple technology to communicate with their patients and help the patients understand how many resources there are in the doctor's office to help them. Because even though it hurts and they think the doctor's going to help them fix whatever hurts, chances are it's the stresses of daily living that are causing the real problem. And they can go to the doctor any number of times, take any number of meds and prescriptions, do tests of all sorts, and they don't solve the problem. You have to recognize early on that the problem is complex. People are complex, and there is a body-mind connection. that needs to be explored with every patient visit, and that's what we help people accomplish. Thank you. In addition to working with patients on the front end, we also built products to track patients' progress in treatment. We built a system for a residential care company that had dozens and dozens of these small 16-bed residential care facilities for patients with a dual diagnosis of mental health and substance use. We help them communicate to the insurers that patients don't get better in a week or two. So we installed this software on patient terminals in each residence, and once a week patients would go to the terminal and they'd answer a few questions. We particularly implemented a psychological questionnaire called Promise 57. And using that data over time, we could show the trajectory of healing the patients went through. And the data was essential to show the insurers what it would take to make the patients healthy, help patients heal. And it's a months-long process. And the first 2 weeks, the data looks worse and worse as people decompensate and say, at last I'm going to get help, I can relax. And so things look like they're going the wrong direction, but that's all part of healing. And then after a few weeks, the data starts turning upwards. And we show this longitudinal track to the patients. So then not only do they see that they're recovering, they're encouraged to see that they're recovering because they may not notice it themselves. So this was a year-long program, and it was very essential and very helpful to the company. And again, outcomes measures, outcomes tracking is another part of what we do. It's very important in Medicaid clinics because now they're being held responsible for outcomes, and they need to have a measure of outcomes. And it's more complex than using a PHQ-9 for outcomes. Don't get me started.